Which of the following proteins is most likely affected in this patient? Okay. A 5-year-old boy is referred to a child psychiatrist due to concerns about his behavior and development. His teacher reports that he has trouble paying attention and frequently disrupts the class with outbursts. The boy's parents mention that he struggles with speech and often repeats certain phrases or words. On examination, the patients note presence of macroorchidism.
Mhm.
Which of the following proteins is most likely affecting this patient? I was lost until they said macroorchidism. I was thinking ADHD, and then I was thinking Tourette's, maybe.
Okay.
But then macroorchidism, I think, is just what's it called? Fragile X syndrome.
Okay.
And so dystrophin is a DMD. That's not the case here. Huntington is Huntington's disease. FMRP1 is Fragile X.
Okay.
Ataxin, I should know that. I don't know exactly. And then SMN. Ooh, SMN. No, it's FMRP1, I think.
Good. Good. Yeah. So you got Fragile X pretty fast. Then kind of picking your answer choice to what does it go to fit Fragile X, right? That's going to be your key. So FMRP is going to be your answer. Dystrophin, like you said, Duchenne muscular dystrophy, Huntington's disease is, sometimes even though you're like, oh, I don't know, right? But they name things. I think scientists become very unoriginal, right? When they start
Yeah.
finding stuff, right? So if it looks like it, it probably is, right? And this is your ataxin, which is your spinal cerebral ataxia. So, which makes sense. It says ataxin in it, right?
Yeah.
SMN, spinal muscular atrophy. So, yeah, things to think about. Not super difficult to remember these things because they do name the proteins usually after the disease, because I think for the most part they if you think about science, it works like this, right? I mean, they come up with the disease based on symptoms first, and then we start doing research on the disease and then find out proteins associated. So they
Mm,
usually are coming up with the name of the disease first and then finding the proteins after. So they're trying to name the protein after the disease, if that makes sense.
yep.